The measles outbreak here in the United States continues to grow, with 9 states now reporting cases, including California, New Jersey, and New York. According to the CDC, 20% of the reported cases have required hospitalization, and most of those infected have been children. Joining us now, NBC News medical contributor, Dr. Vin Gupta. Dr. Gupta, it's good to see you this morning. So since we spoke last a week or so ago, more cases. This does appear to be growing. What should people know about it this morning?
Willie, good morning. Yeah, you were spot on in the lead up. This is 20% hospitalized, about 170 cases so far. 95% of those cases, Willie, primarily in children, less than 17 years of age, mostly under 5, 95% unvaccinated. So I think, number one, this is going to get worse before it gets better. We're on track for this to be the worst year for measles. I mean, we're still only in March. That we probably have seen since we thought measles was eradicated in 2000. So this is an unusual year, probably going to extend out to more states. Here's what we need to know. First of all, number one, vaccination can have an impact, Willie, within just a matter of days, even just one dose. So if you're a parent out there, you're living in one of these states, we have cases here in Washington State, get your children vaccinated. If you are unsure of your own vaccine status, if you don't know if you've gotten 2 shots of the measles vaccine at some point in your life, get a booster shot or get your titers checked. It's really important. And number two, just to clarify something that the health secretary said, there is no evidence. He really underplayed the role of vaccination just a few days ago when he released a statement, Willie. Number one, there is no treatment for measles. It's all prevention, number one. Number two, he started referencing things like cod liver oil in his formal statement. There is no physician that's credible that I know of. There's no guidelines from a society basis saying that cod liver oil is something that we utilize, but he really emphasized that in his statement. I think it's important to clarify and fact check.
Yeah, Dr. Gupta, he's also talked about vitamin A, again, not a replacement for vaccines. How damaging is it to amongst communities where there is hesitancy still about the measles vaccine, although we know that the idea that it's linked to autism has been thoroughly debunked? How damaging is it to have the health secretary not push vaccines? I mean, not be much more assertive in the pushing of vaccines as opposed to these alternative therapies?
Well, thank you for bringing that up, Katty. It is important. It's important to realize what he's actually doing, what he has a history of doing, that angers all of us on the clinical side. We have to deal with these consequences at the bedside. He doesn't, nor does his team of advisors. Number one, his former organization, the Child's Health Defense, has put a lot of information just in the past few weeks about how the measles vaccine is causing the outbreak because, quote unquote, it's somehow ineffective. That's what his deputies at his former organization are putting out there. Incredibly damaging, because that's part of the reason why people are not getting vaccinated. We're seeing a direct line between a no vaccine status and this outbreak. And part of it is why people are confused about the purpose of vaccination. And he has been one of the leading misinformers of that, whether he wants to admit it or not. So that's number one. Number two, this notion that there is treatments out there. What he's saying in the statement is downplaying proven ways to avoid measles in the form of vaccination, normal infectious disease hygiene. And he's saying that there's treatments out there that somehow we in the medical establishment have been hiding from people. That's what he's saying. That's what he's directly implying, and it's wrong.
So, Dr. Gupta, the Trump nominee to head NIH, also facing some real scrutiny during his confirmation process. In the past, he has said some deeply dubious things, linking vaccines with autism. He's trying to back off that of late. But give us your assessment as to his candidacy, but also just how dangerous are these ideas, particularly as we just discussed, moments where vaccine intake is decreasing and diseases and viruses are rising.
My concern with the NIH nominee, he's a physician in name only. He didn't practice, or he's not actually a clinician. He's an economist, very accomplished academic at Stanford. So, he's done a lot of good academic work. But since the pandemic, he's put out a lot of fringe ideas. And so, Jonathan, exactly to your point, he was deadly wrong on the COVID. He said that he underestimated the death toll by about 95%, put out a big declaration that you and I talked about back in the day, the Great Barrington Declaration. Deeply, deeply misinformed, did a lot of damage because people said, oh gosh, shouldn't we be doing what they're saying, let the virus rip, instead of doing what we should have been doing, which is protect as many people as possible. Over 1 million people died, by the way, so he was deeply wrong. He said about 20,000. He's also done the vaccine autism link. My worry here is that the NIH director, as it's been under Francis Collins up until recently, should be independent in many ways, that it should be a clinician, somebody that's respected in the clinical community. He is not. He is not a clinician. And as a result, is he going to be a stopgap when it comes to policies that many of his peers in the clinical community disagree with? And the answer to that is it's not clear. He didn't really answer any questions that were hard in his confirmation hearing yesterday. And by the way, this is happening, Jonathan, at a time that we're losing budget from the NIH. Key scientific studies on climate change, on environmental justice, on cancer chemotherapy, frankly, just given these cuts, are at risk. And he didn't really have anything to say about that.
So, Dr. Gupta, let's talk about another area of proposed cuts, which is Medicaid. The Republicans coming out saying they want to cut $2 trillion in spending over the last decade. As we've said many times on this show, you can't get anywhere close to that number without getting into programs like Social Security, Medicare, Medicaid. So we talk about the politics of it often, but take us down to the ground level and what major cuts to Medicaid would mean for health care in this country.
Yeah, I'm glad you asked that, Willie. So, Medicaid, about 70 million people across the country and every state in the union rely on Medicaid. They rely on Medicaid to access the ER, to access urgent care if they have flu-like symptoms, if perhaps they had a measles exposure. 70 million people across the country, 1 in 5 Americans, use Medicaid to access a physician. If they need ICU level care, Medicaid provides that. So it's a critical backstop. 50%, Willie, of nursing care across the country, 50% is funded by Medicaid, 40% of new births. So this is a big deal. This is all your viewers out there either are directly impacted by Medicaid, having access to it, especially, by the way, over the last 10 years, Medicaid rolls have increased. That means more people are productive, healthier, able to have a gainfully employed job, produce in this economy. This is not just, oh, we're making them healthier. No, it's a healthier labor workforce. But yes, critically, Medicaid is the greatest public insurer in the world in terms of just lives covered. Health impacts would be dramatic, massive, and frankly catastrophic, especially at a time in which what we're seeing here is more people now have healthcare access, Willie, in the last 8 years than they've ever had before in relative terms. We're going to see reversal in that progress if these cuts end up bearing out.
And of course, as you point out, this cuts across political lines and partisanship and ideology. This is people of all stripes, all states, red, blue, who just want medical care. NBC News medical contributor Dr. Vin Gupta covering a ton of ground for us this morning, as always. Dr. Gupta, thank you. Coming up on Morning Joe.